I'm Dr. Jeremy Good with the Advanced Spine, Joint, and Wellness Center here in Medina. Sitting to my left here is Pierre, the physical therapist, and he's going to discuss today a couple of different things. We're going to talk about how pressure on a nerve creates pain, but how a very specific protocol that we do here, called McKenzie protocol, can help with that. So I'm going to turn it over to Pierre and let him begin his explanation.
Thanks, Dr. Good. First, I want to touch base with those people out there who have said that they've tried therapy before and it hasn't been helpful to them. If you haven't tried the McKenzie protocol, I really do encourage you to try that protocol, as it's been very effective for our clients here in reducing their pain, and all exercises aren't created equal. McKenzie protocol isn't a protocol that we learn in school. We either learn it through continuing education or through other clinicians who have taken the course. First of all, we assume pretty poor postures in today's society. We're having more sedentary jobs, we're sitting at desks, we're living more sedentary lives. We do a lot of sitting while watching TV, and a lot of us are assuming slouched and head forward postures. That can have an effect on the position of the discs in our spine here. So Dr. Good's going to lend a hand figuratively and literally. So Dr. Good's fist here is the disc, and my fists here are the vertebrae. So what are we doing when we're leaning forward? We are bending forward and we're translating that disc posteriorly or backwards. And that disc can put pressure on our nerves. So what is our goal with the McKenzie protocol? These exercises are trying to get this disc back into place. So usually if the disc is displaced posteriorly or towards your back, we're going to go into some extension exercises, and we're going to do this repetitively to try to scoot that disc back into place. Now while you're going backwards, we are pinching the disc, so you may experience some discomfort. But when you come back to neutral, that disc should be in a better place, so your pain should be no worse or even better if we translated that disc back into place. Thank you, Dr. Good. So we do have you do this exercise quite frequently, every 2 hours. And so that's the key catchphrase to help you know if you've done this exercise or this type of therapy before, the every 2 hours. But that every 2 hours is because a lot of times when you're in the first phase of healing, your body has the propensity to go back to where it was before. We assume those same poor postures, pushing that disc backwards again. So do those exercises repetitively to put it back into place, and also pay attention to your posture so you're not undoing the things that you've done to correct the problem in the first place. And I know what you're thinking, Dr. Good. What if I don't have time to do the exercise? I'm going to challenge you to do the exercise and find time. This exercise is the exercise that helps you with your pain, and it should only take you 30 seconds to a minute to do it. I know what you're thinking again, Dr. Good. I really can't find the time to do it every 2 hours. So again, your homework then is to really pay attention to your posture. Make sure that you're not assuming those poor postures, those flex postures, the head forward postures that are going to get you in a bad situation again. I know what you're thinking, Dr. Good. I'm a smart guy. I've taken anatomy before. Can you give me a term that, just people can understand who haven't taken anatomy? Well, if you have a cut on your finger, and your knuckle here, what are we trying to do with that cut? Are we bending forward all the time? No, because we're not allowing those edges to come together and heal. So we want you to keep yourself in good posture, and we're also going to want you to go into some extension to keep that finger, the knuckle there, and the edges of that cut together so it can heal. So what happens when you don't do your exercises or you assume that poor posture? You're bending that knuckle and you're not allowing it to heal to its optimal level. But once it is healed and that skin is back together and it's healed all back to where you want it to be, you can bend that finger and no problem. Those were good questions, Dr. Good.
Well, thank you very much, Pierre. I think that was an excellent explanation of the McKenzie protocol. And if anyone out there is suffering from back pain, disc pain, pressure on a nerve pain, please give us a call here at the Advanced Spine, Joint, and Wellness Center, 330-721-6504. Again, 330-721-6504. Have a beautiful day.